Did you know that prostate cancer is one of the most common types of tumors in men worldwide? Despite its prevalence, many people overlook subtle signs that could indicate the onset of this disease. Today, we'll discuss the early symptoms that should never be ignored, the most significant risk factors, and the preventive measures every man should know. Stay until the end to learn how to recognize potential changes in your body and ensure effective treatment when necessary. The role of the prostate. The prostate is a small but critical gland in the male reproductive system, located below the bladder and in front of the rectum. It plays a key role in producing part of the fluid that makes up semen, which supports the nutrition and protection of sperm. However, any imbalance in this gland, whether due to inflammation, such as prostatitis, or the emergence of abnormal cells, can have serious repercussions on overall health. Prostate cancer occurs when prostate cells mutate and multiply uncontrollably, potentially forming a tumor. In most cases, it is a slow-growing condition, but in certain instances, it can become aggressive, spreading to other parts of the body. Understanding the prostate's function and location is crucial for recognizing potential warning signs early. The importance of early diagnosis. Early detection is the cornerstone in the fight against prostate cancer. In its initial stages, the disease may not present clear symptoms, causing many men to live with it unknowingly. This is why routine screenings, such as the PSA, prostate-specific antigen test, and the digital rectal exam, are so important. When prostate cancer is detected early, the chances of successful treatment increase significantly. Therapeutic approaches are also less invasive in the initial stages. Unfortunately, the stigma and fear surrounding the digital rectal exam deter many men from seeking medical evaluation. It's vital to prioritize health over cultural barriers or prejudices. Doing so can save lives. What can trigger the disease? Several risk factors are associated with prostate cancer. Age. Men over 50 have a significantly higher risk, although cases of early-onset prostate cancer do occur. Family history. If a father or brother has had the disease, the chances of developing it increase substantially. Race. Black men statistically have a higher likelihood of developing prostate tumors compared to men of other ethnicities. Lifestyle. Diets high in animal fats, physical inactivity, and excess weight can contribute to the onset and progression of cancerous cells. Maintaining a healthy diet and a regular exercise routine is often recommended to reduce these risks. Early symptoms of prostate cancer. 1. Changes in urine stream. One of the first symptoms men notice is a change in urinary flow. You might experience difficulty starting urination, a weaker urine stream, or interruptions during bladder emptying. A persistent sensation of not being able to completely empty the bladder can also occur, causing discomfort and anxiety. While these signs are often linked to a benign condition called prostatic hyperplasia, they can also indicate prostate cancer in its early stages. If you notice changes in your urinary patterns, seek medical evaluation promptly. 2. Increased nighttime urination frequency. Waking up several times during the night to urinate, known as nocturia, is another symptom that many men ignore. This can be caused by various conditions, including infections, poorly controlled diabetes, or prostate enlargement. An enlarged prostate exerts pressure on the bladder, triggering frequent urges to urinate. Interrupted sleep can lead to fatigue and irritability, affecting overall quality of life. While this may seem like a normal part of aging, worsening symptoms or accompanying pain should prompt a visit to your doctor. 3. Presence of blood in urine or semen. Hematuria, blood in the urine, or hemospermia, blood in the semen, are alarming symptoms that should never be ignored. These signs may have various causes, such as urinary infections or kidney stones, but when linked to the prostate, they could indicate tumor lesions. This symptom often appears in more advanced stages of prostate cancer, but each case varies. If you notice blood in bodily fluids, seek medical evaluation promptly. Imaging tests, laboratory analyses, and sometimes a biopsy may be necessary to determine the cause. Preventive measures and moving forward. Prostate cancer can be a life-threatening disease, but early detection and preventive steps can make all the difference. Here are some actionable tips. Schedule regular screenings. Annual PSA tests and digital rectal exams are crucial, especially for men over 50 or those with a family history of the disease. Adopt a healthy diet. Focus on fresh fruits, vegetables, whole grains, and lean proteins. Limit red meat and processed foods. Stay active. Regular exercise helps maintain a healthy weight, improves circulation, and reduces overall cancer risk. Listen to your body. Don't ignore subtle changes. Early symptoms can be easily managed if caught in time. Conclusion: prostate cancer is a serious health concern, but awareness and proactive steps can significantly improve outcomes. By recognizing early symptoms, understanding your risk factors, and committing to preventive care, you can take control of your health and well-being. Your health is your priority. Don't let fear or stigma prevent you from seeking the care you need. Stay vigilant, consult with your doctor regularly, and empower yourself with the knowledge to protect your body. After all, early action can save lives. Recognizing the symptoms of prostate cancer. What every man needs to know. Prostate cancer is a significant health concern for men worldwide. While some symptoms may appear subtle, they should never be ignored. Early recognition can make all the difference in ensuring effective treatment and better outcomes. This guide will help you identify key warning signs and understand the importance of seeking timely medical attention. Symptom 4. Pelvic pain or discomfort. Pelvic pain is often associated with inflammation or muscle issues, but the pelvic region contains vital organs, including the prostate. Persistent feelings of heaviness, discomfort, or sharp pain in the lower abdomen, lower back, or genital area could signal tumor growth. This discomfort may even radiate to the back, making everyday tasks like walking or sitting for extended periods challenging. In advanced stages of prostate cancer, this pain may become constant. Many patients mistake it for muscle strain, delaying medical evaluation. Persistent pelvic or lower back pain should never be underestimated, as it could indicate a more serious condition. Symptom 5. Changes in ejaculation. Prostate cancer can directly impact the processes involved in producing seminal fluid and releasing sperm. Men may notice reduced semen volume or experience pain during ejaculation. While such changes are often mistaken for infections, persistent symptoms deserve close attention. Tumors compressing nearby structures can alter the function of the ducts responsible for semen transport, resulting in changes in texture, color, or fluid quantity. If these symptoms persist for weeks or worsen, a professional evaluation is critical. Many prostate cancer cases are diagnosed at this stage, often before more noticeable urinary symptoms develop. Symptom 6. Difficulty maintaining an erection. Erectile dysfunction, ED, can arise from numerous causes, including diabetes, circulatory problems, and medication side effects. However, changes in the prostate gland may also play a role. Growing tumor cells can disrupt blood flow to the corpora cavernosa of the penis, impairing the ability to maintain erections. If ED occurs suddenly or progressively worsens, it's essential to investigate further. A simple urological checkup can determine whether the cause is related to prostate cancer or another condition. Early intervention not only improves quality of life, but also ensures proper management of any underlying issues. Symptom 7. Feeling of bladder pressure. A persistent sensation of a full bladder, even after urinating, is a common complaint among men with prostate problems. This symptom often occurs when an enlarged prostate creates a partial obstruction, preventing complete bladder emptying. This residual urine can lead to discomfort and force men to strain their abdominal muscles while urinating, exacerbating the problem. Left untreated, this condition may result in complications such as recurrent urinary infections, as the remaining urine promotes bacterial growth. If bladder pressure persists, consulting a specialist and undergoing imaging and laboratory tests is highly recommended. Symptom 8. Unexplained weight loss. Sudden, unintentional weight loss is a warning sign often associated with various cancers, including prostate cancer, particularly in advanced stages. Tumors can trigger metabolic changes and loss of appetite, leading to significant weight loss. This symptom may also be accompanied by fatigue, paleness, and weakness. If you notice your clothes fitting looser and your appetite diminishing without a clear reason, it's essential to seek medical evaluation. While weight loss can result from other health conditions like hyperthyroidism or gastrointestinal disorders, a thorough investigation is necessary to rule out serious issues, including cancer. Symptom 9. Fatigue and persistent tiredness. Relentless fatigue that persists even during routine activities is a nonspecific but concerning symptom. Tumor growth often redirects significant energy within the body to combat the disease, leading to metabolic changes that hinder nutrient absorption and tissue oxygenation. This chronic tiredness can severely impact productivity, mood, and overall quality of life. If you notice a marked decline in energy levels without any changes in habits or increased stress, it's important to consider prostate health as a potential cause. Persistent fatigue, especially when combined with other symptoms, warrants prompt medical attention. The role of routine exams. When it comes to detecting prostate cancer, 2 exams are particularly vital: the PSA, prostate-specific antigen test, and the digital rectal exam. PSA test. This blood test measures the levels of a protein produced by the prostate. Elevated PSA levels don't always indicate cancer, but significantly high values can be a red flag. Digital rectal exam. This physical examination allows the doctor to assess the prostate gland's texture, size, and shape. Combining these tests improves the accuracy of detection. In some cases, additional imaging tests such as a transrectal ultrasound or an MRI may be required to confirm the diagnosis. Don't ignore the signs. Prostate cancer can often progress silently, making early detection crucial. Symptoms like pelvic pain, changes in ejaculation, erectile dysfunction, bladder pressure, unexplained weight loss, and persistent fatigue should never be overlooked. Routine screenings and timely medical evaluations are your best defense against this disease. If you experience any of these symptoms or notice unexplained changes in your health, consult a specialist promptly. Your health is your priority. Awareness and early action can save lives, ensuring a better quality of life and successful treatment outcomes. Stay informed, vigilant, and proactive. Prostate cancer, understanding, prevention, and hope. Prostate cancer is one of the most common cancers in men, and understanding its signs, risk factors, and treatments can make all the difference. Let's explore the critical role of regular screening, treatment options, lifestyle changes, and breaking taboos around men's health to ensure early detection and better outcomes. The importance of regular exams. For men aged 50 and older, or 45 if they have risk factors, regular consultations with a specialist are essential. Routine evaluations, including the PSA, prostate-specific antigen test, and digital rectal exam, help detect abnormalities early. The frequency of these checkups should be discussed with a doctor based on individual risk factors. When diagnostic tests and biopsies confirm the presence of malignant cells, determining the stage of the tumor is the next crucial step. This allows for tailored treatment plans. Open communication with healthcare providers and considering second opinions are strongly recommended during this challenging time. Treatment options and potential side effects. Several treatment approaches are available for prostate cancer, depending on the cancer stage, aggressiveness, and the patient's overall health. Each method has its benefits and potential side effects. Radical prostatectomy. This surgical procedure removes the prostate gland, commonly used when the cancer is localized. While often effective, side effects such as urinary incontinence and erectile dysfunction can occur. Radiation therapy. Radiation therapy, delivered externally or internally, brachytherapy, targets tumor cells. Common side effects include fatigue and irritation of the bladder and rectum. Hormone therapy. Hormone therapy reduces testosterone levels, slowing tumor growth. However, it can cause hot flashes, bone density loss, and decreased sexual desire. Chemotherapy. Chemotherapy is often reserved for advanced stage prostate cancer or cases resistant to other treatments. Side effects vary but may include fatigue, nausea, and weakened immunity. Although each treatment carries risks, the success rates are promising when therapies are appropriately chosen and administered, maintaining quality of life during and after treatment. Managing side effects and maintaining quality of life are critical during prostate cancer treatment. Several strategies can help. Physical exercise, supervised activities, and pelvic physiotherapy can strengthen the pelvic floor, improving urinary control and reducing incontinence. Nutrition. A balanced diet boosts immunity, enhances recovery, and provides the body with essential nutrients. Psychological support. Emotional support from family, friends, or support groups can alleviate the psychological burden. Seeking professional counseling can also be highly beneficial. Facing prostate cancer is challenging, but leaning on loved ones and seeking professional help can significantly ease anxiety and fear. The role of a balanced diet. Diet plays a crucial role in preventing and managing prostate cancer. Foods rich in vitamins, antioxidants, and fiber, such as fruits, vegetables, legumes, and whole grains, help defend against free radicals and inflammation. On the other hand, excessive consumption of fatty red meats, processed foods, and ultra-processed snacks promotes inflammation, increasing the risk of cancerous cell growth. A Mediterranean-style diet rich in fish, olive oil, and vegetables has shown significant benefits for men's health. Additionally, moderate consumption of soy products may positively influence hormonal balance. Beyond diet, exercise and lifestyle, physical activity and weight control are powerful tools in cancer prevention. Regular exercise strengthens the immune system, regulates insulin levels, reduces chronic inflammation. Conversely, a sedentary lifestyle promotes fat accumulation, disrupts hormone production, and increases the risk of mutations. Incorporating enjoyable and manageable activities like walking, swimming, or cycling into daily routines under professional guidance ensures safety and effectiveness. Equally important is mental health. High stress and anxiety levels can exacerbate inflammation, creating a favorable environment for tumor progression. Stress management through mindfulness, meditation, or hobbies can enhance overall well-being. Breaking taboos around men's health. The reluctance of some men to discuss health issues, especially intimate ones, remains a significant barrier to early prostate cancer detection. Many avoid the digital rectal exam due to discomfort or embarrassment. However, this quick and vital procedure could save lives. Awareness campaigns like Movember aim to dismantle these taboos. Participating in such initiatives, discussing symptoms openly with friends and family, and encouraging routine exams can normalize male healthcare discussions and help detect problems early. Vigilance during and after treatment. For those undergoing or finishing treatment, regular follow-ups are crucial. These include repeated blood tests, imaging scans, and doctor consultations. While this vigilance may cause apprehension, it ensures that any recurrence or progression is detected early. Prostate cancer cure rates are highly encouraging, particularly with early detection. Continued advancements in medical technology and treatment protocols further improve outcomes. A preventive mindset. If you experience unusual symptoms or have family risk factors, seek medical attention promptly. Knowledge, routine screenings, and a proactive approach are invaluable allies in the fight against prostate cancer. Final thoughts. Prostate cancer is a formidable challenge, but early detection, personalized treatment, and lifestyle adjustments can significantly improve outcomes. Eating a balanced diet, staying active, and prioritizing mental health are essential components of prevention and recovery. Awareness and open communication are key. By breaking down taboos and embracing regular health checkups, men can safeguard their well-being. If you notice any symptoms or have concerns about your prostate health, consult a doctor without delay. Remember, early detection and timely treatment save lives. Take charge of your health confidently and proactively. Disclaimer: this information is based on reliable medical sources but does not replace professional healthcare advice. Always consult a qualified medical professional for concerns or symptoms.